All right, hey guys, I'm Dr. Justin Scott from Pure Dental Health. Here today with Angela, my dental assistant, my orthodontic assistant. We're here today to talk about 6-month smiles and why that would be a great option for you to get your teeth straightened. So a very common topic right now is do-it-yourself braces, and I'm not going to name any companies because there's a lot of them now. I mean, there's
at-home aligners.
At-home aligners, do-it-yourself. There's a lot of companies out there that are offering. They're saying, skip the dentist, just take your own impressions, get your own aligners made, and then your teeth will be straight. It'll be perfect.
Just do it at home. It's cheap, it's easy, it's quick.
And it's definitely cheaper when you don't have a professional.
It is, but you definitely get what you pay for.
Now, I think there's some situations where you can get away with it. Some things are straight. I mean, you know, I'm rebuilding my house right now. I could just hire people, they're subcontractors, to go in and do the work. But if they mess up, what happens? Mm-hmm. Who's left holding the bag? I'm left holding the bag. And then what I probably have to do is I have to hire somebody to fix all the stuff. And we see that a lot, right?
We do see that a lot. I have a lot of at-home aligner fails that come in and they're like, I tried, didn't work, I wasn't happy, save me.
Yeah, and that's kind of sad because you've already spent $2,000. Now you have to spend more money to come back and have things fixed. Mm-hmm. But the scarier thing is that there's been a lot of cases in the news. If you do some Google searches, there's been a lot of lawsuits about people that may have had gum disease or they may have had other problems that they weren't aware of, but once they started moving the teeth, those problems started to cause real problems where they lost teeth or things like that. So have you seen anything like that yet?
I have, yeah. I've heard stories of patients that haven't been to the dentist and they don't know how long, but they want to straighten their teeth and they want to do it for cheap and they want to do it at home, so they do it. And once you start pushing teeth around, moving teeth around with active gum disease, it can definitely cause some issues.
Yeah, so the number one thing, if you decide to do it yourself, is to make sure that your gums are healthy, your teeth are healthy, you're seeing a dentist regularly, and then if something goes wrong, you at least know that you had a healthy foundation to work from. I think that in some people, they can get decent results, but whether or not you're going to get good enough results, whether you're going to get accurate results, a lot of my patients are incredibly picky and they want things to be perfect, and I'm okay with that.
Absolutely.
Because I know how to deliver that.
When our 6-month smile patients come in to the office, they see you and I, we have complete control over the movement of the teeth, over if there's an issue or a problem, we can address it right then. Whereas with aligner therapy, it is either you stop and you restart, or you finish off that set and get a whole new set. And it can kind of, like you said, put a lot of treatment time on the end.
I think it a lot of times leaves the patient holding the bag in that they've already invested a lot of money in something and then they have to kind of do it over. So I personally like to do it right the first time.
Just makes sense.
And I don't mind, even though $1,800, I'm guessing that's the number, I'm sure some are less, some are more. That's a big investment to make and it not to work, to not get the result that I want. So, I mean, I guess if it was $50, maybe I would try that and hope that it was going to get better, but because I'd be willing to let go of $50.
Of course.
But at that high price point for it not to work, that would be very upsetting for me.
It's a little devastating, and like we spoke about, we have
may work, may not work.
We have the patients that come in that are like, I had the at-home aligners, and look what it did, and oh, I wish I just would have come here first.
Right.
And I always tell them, yep, we've heard that before.